And there are new questions tonight involving Indiana's largest health network amid allegations of risky care for low-income pregnant women. A local mother is coming forward to tell her story of what she calls a botched delivery and missing medical records.
Yeah, our 13 Investigates reporter Sandra Chapman first introduced us to the doctor who filed a federal lawsuit against IU Health for allegedly putting mothers and babies in danger. Tonight, Sandra shows us why it's too late for this mother, whose little girl is still fighting to reclaim what she lost.
Yeah, let me see.
That's how high I can use it. This is how high I can use it.
Limited arm movement is all 10-year-old Crystal has known. It's one of the lasting effects of what her mother calls a botched delivery.
She's my blessed miracle baby.
A baby that wasn't supposed to make it out of the neonatal intensive care unit at Methodist Hospital. Now, a sweethearted little girl. Yet Crystal still fights against short-term memory loss.
I feel like I'm dumb.
And hurtful teasing over a wandering eye.
I want to have the eye surgery. I cannot make people bully me anymore.
For the first time, corrective surgery could be in her future. Crystal's mother, Dorothy Creek Riggle, says she was in the dark for years about the extent of trauma Crystal suffered during childbirth. Not even schools that worked with Crystal could get their hands on her health records.
They've been trying to obtain records since kindergarten on her.
According to Dorothy, the health records at IU Health mysteriously disappeared until 2013, nearly 10 years after things went horribly wrong in the hands of a certified nurse midwife.
How can they keep records from somebody like that?
The records were eventually obtained by Wayne Township schools and show Crystal suffered respiratory failure, hemorrhaging, a brain injury, and seizures as the result of a traumatic birth. Records or not, Dorothy says she'll never forget what happened. Her 10-pound, 9-ounce baby girl was supposed to be delivered by C-section. Doctors at HealthNet had deemed the pregnancy high risk after Dorothy's water broke at 24 weeks. On October 29, 2004, Dorothy went to Methodist. There she told a midwife the baby was coming.
I was like, look, I'm telling you, this baby's a huge baby. Me and my doctor's already discussed it. I'm having a C-section. You need to get my doctor here. She said, well, I will decide when and if you need a doctor.
Dorothy says continue please went ignored.
She said, you're fine. You're just being a wuss. Keep going. And then the monitor started going off. So she left the room.
That's when Crystal began to emerge and the midwife reportedly got help.
She didn't care until it was, oh crap, it's time to get somebody now. And by then it was too late.
Crystal was stuck and couldn't get oxygen.
I was freaking out. She wasn't crying. There was nothing. It was like that for 10 minutes. She was gone.
Or so she thought. Crystal was whisked away. Another team got busy on Dorothy, who had suffered extensive tearing and permanent damage.
It was just botched. Everything became hush mouth.
That's when Dorothy decided to pursue legal action. She didn't get far. She says attorneys threw up their hands when they couldn't get hospital records. By the time Crystal's school got them, the statute of limitations had run out.
More and more women are now aware of what happened to them.
Personal injury attorney David Stewart is representing 4 mothers who are filing medical malpractice complaints against IU Health and its network. He says mothers only have 2 years to file a lawsuit if they are injured, but up to 6 years on behalf of an injured child.
If the statute has expired on a case, and say that it is past the 6 years, then yes, that would be a problem.
Dorothy's family called 13 Investigates after seeing our story with Dr. Judith Robinson, who came forward with disturbing allegations in a whistleblower lawsuit.
These women were not receiving the care that they should.
Dr. Robinson alleged IU Health allowed certified nurse midwives to handle high-risk pregnancies for low-income women, putting both the mothers and their babies at risk. Robinson alleges it was a money-making scheme and claims the IU Health Network submitted bills in a physician's name when the service was actually performed by a certified nurse midwife.
It was very lucrative for them to have this process going.
In fact, Robinson was a private physician with on-call duties at Methodist when Dorothy gave birth to Crystal in 2004. It was Dr. Robinson who signed off on Dorothy's dismissal instructions from the ER days after she returned to Methodist with an infection. Fast forward to 2011. As the medical director at the Maternity Center for Health Net and the former director of Women's Health at Methodist, Robinson alerted administrators to permanent injuries suffered by mothers and babies at the hands of certified nurse midwives. Robinson says no one listened and she was fired.
It was my job as medical director of the maternity center to ensure patient care and safety. And so I would take it to the next higher level. And the next higher level did not care.
I was failed. Like she was failed. Like nobody cared.
Now mothers like Dorothy are speaking out too.
I'm nobody. I'm not the government. I'm not the state. I'm not Medicaid. I'm just somebody who was poor, who didn't have any money.
No money to fight a big health system and possibly nothing to make up for what was lost. Yet Crystal, with childlike eyes, sees what money can't buy, something etched in her long-term memory, and restores a hurting mother's honor.
She's thoughtful. I love her. She's a great mom. She usually cooks good food. And she loves me.
Doctors are now discussing corrective surgery for Crystal. In a statement, IU Health partner HealthNet says, due to our patients' privacy rights, we cannot comment on care provided. We follow the standards of care developed by the American College of Nurse Midwives and the American College of Obstetrics and Gynecology and stand by our collaborative model of care. Crystal's mom says new attorneys tell her if they can prove the medical records were somehow misplaced or withheld, she could still have a case. Sandra Chapman, Channel 13 Eyewitness News.